Tearing an ACL can happen to anyone, whether you're an athlete or not. But if it does happen to you, the process of healing from an ACL is very effective if you follow these 3 significant steps. One of the most important steps is to undergo surgery. Going through therapy before and after surgery is very crucial into healing the torn ACL. Many physical therapists and surgeons believe that these following procedures and steps are the most efficient ways to heal a torn ACL. So the first step we will begin is therapy before surgery. So studies show that rehab before the ACL surgery does improve knee strength. According to the Journal of Orthopedic and Sports Physical Therapy, a study of 100 people in 5 weeks program showed that therapy before the surgery did improve knee strength and was beneficial to the knee injury. Most of the therapy exercises are also done after surgery. So this also helps the patient know what types of exercises they will be doing after surgery, which boosts their confidence and limits confusion. So now we move along to the second step in ACL surgery. So after the short-term therapy is done, the following step is to have surgery. So when an ACL is completely torn, some surgeons will give you the option whether or not to have surgery. So this option is given to people who are most likely older and will probably be less active because the ligament is already torn. So there's really no need to have surgery, especially because some people also do not feel pain even if the ligament is completely torn. So according to the Open Access Journal of Sports Medicine, graft options in the patella tendon and the hamstring tendon are what replace the actual ACL in the knee. So altogether, this procedure will take no longer than 2 hours. So finally, the last step to do to heal a torn ACL is to go through rehab after surgery as well. So according to orthopedic surgery, the most important reason to go through rehab after surgery is to prevent muscle atrophy. So because patients will not be able to apply pressure or walk on your leg, you will most likely lose muscle because you're not applying any pressure, you're not going to be able to walk, and you're basically on crutches the first couple of days. So you will most likely lose muscle on your quadriceps of the femur, and your muscles will begin to shrink. So the usual estimate recovery time of an ACL reconstruction is 6 to 9 months. The first month is very important because it determines whether you will be able to regain your full flexion and extension. Because if you don't, you won't be able to fully extend or fully flex your knee. So the 2nd to 4th month focus on balance and strength of the knee, and the 5th to 6th month focus on strength and conditioning. So altogether, these steps make up the ACL reconstruction, and which is probably how to heal your torn ACL. So an ACL tears can happen to anyone, once again, whether you're an athlete or not. So it is key to begin therapy as soon as the surgery occurs and after surgery in order to have the best results. Also know whether or not you want to have the surgery because the process is challenging and you may not need the surgery. But if you do end up choosing the surgery, know that you will still be able to stay active and move on and carry on with your life with a full recovery as long as you follow these 3 steps and stay determined. Thank you.